play today, or are you guys just dropping off?
Hi, how are you today?
I'm fine, thank you.
The biopsy will tell us maybe at least if there was reduced ganglion cells.
A lot of times in the emergency room, we get presentations just like this.
It's another day across University of Iowa Healthcare. Several thousand people have joined forces yet again for a common mission: to improve the well-being of patients. From research to education to clinical care, this integrated team with one vision and one future is transforming the health of people across the Midwest and making its mark as one of America's premier medical institutions.
The reason we decided to integrate is it makes the place a lot more agile, give an ability to make decisions more rapidly, and also bring this place in a way that there is a single vision, a single mission, and we can really focus both on the education, on research, and on clinical activity with really one single focus.
One of the beneficiaries of this singular focus is Lizeth Garcia. Lizeth was a freshman at University of Iowa, only 18 years old, when her life took a dramatic turn during her second semester.
It was about February, early February, and I noticed some bruises on my legs, and they were identical bruises on both shins, and they were really red and puffy. And so I went to a doctor, and I was on antibiotics for about 2 weeks, and nothing was happening. So finally, I decided that I needed a second opinion. So that's when I came to see Dr. Ann Sullivan at the Family Care Center here.
We ran several tests on Liz looking for possible causes of the erythema nodosum, or red bumps on her shins. And a lab tech read that, actually called me at home that night to say that this is not normal and this is what this looks like.
So I went to the hematologist, which was Dr. Carter. And that's when I had my first bone marrow biopsy with PA Kevin Heckman.
Well, Lizeth was referred to us, as most of our patients were, with a concern about her complete blood count, or her CBC. As it turned out, she in fact had acute leukemia. It's a real shock for almost everyone, and especially for a young person.
My whole family broke, started crying, and my daughter just get out of the room, and she was so strong and say, "Calm down, I'm not dying. Who tells you I'm gonna die for that illness? It's okay, everything is fine." And she was crying, but she was so calm.
That Friday, I was admitted into the bone marrow transplant and leukemia unit on the 7th floor, and Dr. Gingrich was the attending doctor.
I think when we first met in your room, there was this cast of thousands in there of friends, obviously clearly concerned and caring about her. I think we got rid of most of them except for your parents.
I asked the nurses if I can spend the night with her because I don't want to go back to my home. And they say yes if I want it. And I asked if I can have a cot or something to sleep, or if I can sleep in the sofa. They have it in there. And they was really helpful.
The hospital, we all go our extra mile to make the patient or the patient families more comfortable. Anybody wants a bed, they can ask me, they can ask a unit clerk, they can ask a doctor, and we'll make sure that they get one.
There's no question that we have to have a culture of collaboration, a culture where people work together, and where there is one focus, it's the patient.
When Liz and I first met and we talked about treatment options, one of those treatment options was to participate in a clinical trial. And that clinical trial, fortunately, allows us to do some studies on the bone marrow and particularly the leukemia cells, both here and at what is called a core laboratory.
The research showed that I had some chromosomes and that were affected. At first they thought it was going to be a bad prognostic, but then in the end it turned out, after they researched more and found out more of the details on it, they found out that it was a good prognostic. So that was good news.
So with a large medical institution, we had the ability to have enough support staff, enough dedicated individuals, including nursing, to allow us to do clinical trials, provide the medical care, offer these various specialized testing and treatment plans that wouldn't be available perhaps in smaller institutions because they just don't have the dedicated people to do it.
We don't operate as individuals. We operate with that patient at the center, all of us around the outside, doing each of the parts we're given, but we come together as a whole to give the best care we can.
But you've been good, huh?
Oh, yeah.
Good. It's all about the patient. It's no question about this. I think we exist here as a resource for the state, but the resource is not just the patient care, it's also to developing the workforce. That's why we have medical students. But in addition to this, we're creating new discovery, we're creating new knowledge, which we translate to the patient. And that's really what makes us different than other hospitals in the region, and really the only academic health center in the state of Iowa. But it's clearly all about patient at the end.
Because we are doing teaching and research with our patient care, we are changing medicine, we are doing cutting-edge treatments, we are state-of-the-art, we are up to the minute in recommendations, looking at what the evidence is showing as best care.
I think if we all are working together to provide better care and services for our patients, then we'll be one of the top institutions in the Midwest, and not only that, but the nation.
I think it's amazing how, you know, everybody comes together and tries to work around you. You're like the center of the team, basically.
I think we have the best people at any level that are loyal to this place, that are dedicated to this place, that love the state, love the place, love where they work, and I think we'll do everything to make this place successful.
I know why I moved to Iowa, because this is a place where my daughter can have a really good treatment. If somebody can save her life, it's this hospital. It's the best in the nation.